to change. She saw something wrong with my hair, my friends, my table manners, and my attitude. She seemed to exaggerate and lie to justify her assertions. When my father protested, she dismissed him with a wave of her hand. She always had to be right. Over the years, I tried to meet her expectations, but whenever I did, they changed. Despite years of stinging criticism, I never became accustomed to it. Today, I have trouble getting close to people. I can't trust anyone completely, not even my wife. When I feel especially close to her, I brace myself for the inevitable rejection I know will come. If she doesn't do something I can label rejecting, I rebuff her in some way, like getting mad at her for something stupid. Intellectually, I know what's happening, but I feel powerless to stop it. The intensity of BPD behavior. People with BPD feel the same emotions other people do. They do many of the same things that other people do. The difference is that they feel things more intensely, act in ways that seem more extreme, have difficulty regulating their emotions and behavior. BPD does not cause fundamentally different behavior, but behavior that is very far to one side of the continuum. Researchers coined the term borderline in the first half of the 20th century, when they thought people who exhibited behaviors we now associate with BPD were on the border between neurosis and psychosis. Although this concept was discarded in the 1970s, the name stuck. If you learn it's BPD. People who care about someone with borderline personality disorder are usually flabbergasted when they learn that BPD may be at the root of this person's erratic, hurtful, and confusing behavior. They often wonder why they haven't heard of BPD before, especially if they've sought help from the mental health system. Why don't we hear much about BPD? Unfortunately, BPD is not always recognized, even by mental health professionals. Several factors may explain why. 1. The American Psychiatric Association didn't formally recognize BPD in its Diagnostic and Statistical Manual, DSM 1994, a standard reference for the diagnosis and treatment of psychiatric illnesses, until 1980. Many mental health professionals miss signs of BPD in their patients simply because they're not educated enough about the disorder. 2. Some clinicians disagree with the information in the DSM. A few do not believe that BPD exists. Some professionals dismiss the diagnosis as a catch-all designation or a wastebasket diagnosis to describe difficult patients. This is becoming less common as the research has mounted over the years. BPD is the most researched of all personality disorders. 3. Some clinicians believe that BPD is so stigmatizing that they will not label patients with the diagnosis for fear they will become outcasts within the mental health system. Many clinicians make a formal diagnosis of BPD on patients' charts, but choose not to discuss it with the patient. Or they mention it briefly, but do not explain it. To tell or not to tell. As you listen to this book, you may be eager to talk about BPD with the person you think has it. This is understandable. Learning about the disorder can be a powerful, transformational experience. The fantasy goes like this. The person will be grateful to you and will rush into therapy to conquer their demons. Unfortunately, the reality differs. Family members repeatedly told us that their loved one instead responded with rage, denial, and a torrent of criticism. Frequently, the person with BPD traits accused the family member of being the one with the disorder. Other scenarios are possible too. The person with BPD traits may feel such shame and despair that they attempt to hurt themselves. Or they may use the information to deny responsibility for their behavior. I can't help it. I'm borderline. No celebrity has ever admitted to having the disorder, although tabloids and biographies speculate widely, but many show the traits. Issues like eating disorders, domestic violence, AIDS, and cancer often do not move to the forefront of our national consciousness until they affect someone famous. Seek help from a qualified therapist. The issues here are complex. Don't rush into anything. Discuss your thoughts with a qualified therapist who is experienced in treating people with BPD. Generally, it's preferable that the person learn about BPD from a therapist, not from you. If the person is an adult and is currently seeing a therapist, the therapist probably will not discuss BPD with you because of confidentiality laws. You can, however, share your concerns with the counselor. It's likely that other people in the person's life may also respond with denial and accusations, especially the borderline's family of origin, his or her mother, father, and siblings. Keep in mind that it is not your job to convince anyone of anything. People have to be ready and willing to learn. The exception. There are some situations when you might carefully discuss BPD with someone you think has the disorder. If they are actively looking for answers as to why they feel the way they do, if the two of you are not playing the blame game, if you can do so in a caring, loving way and assure the person that you plan on sticking with them through years of treatment, do not make this promise lightly. Making it and breaking it can be worse than not making the promise at all. When you know and they don't. The eggshells get more fragile when you are aware of a possible BPD diagnosis and the other person is not. Sam, for example, says that because he can't discuss BPD with his possibly borderline wife, Anita, she won't take responsibility for her actions and complains that she's always the victim. Talking about treatment, obviously, is not an option. He also feels like he's being dishonest because he uses a separate mailing address to receive